Did you see that? I'm foot.doc.dana and it's time to react to some of the craziest callus and ingrown nail videos on TikTok. By the way, YouTube will definitely demonetize this video, so if you appreciate videos like this, be sure to like and subscribe to support the channel. Okay, let's get started. Okay, first one, this is some extreme callus buildup. And if you guys don't know, this tool that he's using is called a rongeur. We usually use this in surgery for cutting bone, so this is pretty intense. I always talk about using creams and prevention of calluses, but once it gets to this point, it needs to be surgically removed. Okay, now we have an ingrown nail video. Immediately -1, no gloves. All right, that was quick. These kind of videos kill me with this pseudo screwdriver tool. I don't recommend jamming a screwdriver in your toe. One reason here is you can see that little spike on the side of the toenail piece. That's because this has been done before. And again, the ingrown nail is going to keep growing back. This is an example of why you need a permanent procedure to correct these ingrown nails. Okay, so we have another heel callus, and they're pulling out the blade, so you know it's about to get serious. That looks like string cheese and Parmesan. Wow, that is a huge buildup of callus. You'll notice underneath the skin looks kind of yellow. That's from all the buildup of keratin and the carotenoids in the skin making it yellow. When calluses get this big, you just have to shave it. Some things that might make this one worse in particular is genetic disorders. Also, wearing shoes with an open back can make calluses in this area much worse. It can cause cracking, it can cause pain. 10 out of 10 foot scrape. Okay, here we have a discolored nail. Usually with discolored nails, the first thing we think of is fungus, but it could be a few other things as well. Like in this case, it's possible that the person had a trauma, like something dropped on the toe, and a blood blister formed underneath. So what this person is doing is carefully removing the lifting part of the nail. This comes as a surprise to some people, but if your nail isn't attached to your skin, it doesn't need to be there, so you can cut it back. Because if you leave the nail in place, it just can harbor bacteria and things you don't want underneath it. Okay, now this person's going in and showing off their pedicure skills. Just cleaning it up. So what they're using there is a little burr, and they're cutting back the nail a little bit more. Alright, they're going carefully, doing a good job. And so you'll notice in the beginning it looked like this nail might have had fungus, but now that it's getting cleaned up and cut back, it does seem like that discoloration was just from trauma. Oof. I don't recommend being so aggressive on the cuticles though. Your cuticles are there to protect you, so you don't want to cut them off. Okay, going in, cleaning up some more. Ooh, this is a little bit too aggressive on the cuticles. Like I mentioned, I don't recommend cutting them off like that, even though I know it's standard for pedicures. Also, sometimes people asked if your toe is numbed before this. My guess would be that she did not numb this toe. Usually you can cut nails back without too much pain. The pain more comes when there's an ingrown nail or you're doing a procedure where you're removing an ingrowing portion of the nail. That usually needs some injected anesthetic. Okay, now she's just cleaning it up with another little burr. It's like a little toe masterpiece. Also, nails take a while to grow out, so this nail is going to be short for several months at least. Maybe in about 6 months, if all goes well, it'll grow back out to a regular length. But for now, it looks great. She did a good job. Wow, this is an extreme callus. A lot of people in the comments were calling this forbidden cornflakes, and I see the resemblance. But this looks like a case of keratoderma. When it's on only the feet and the hands, it's called palmoplantar keratoderma. This can be due to a lot of different things, including genetics. Things like urea cream and salicylic acid can make it a little bit more manageable. But often these people need to regularly come in to get it trimmed down. Okay, when you tell your boyfriend you are going to get a pedicure and he says 15 bucks, I'll do it for you. Wow, that is a sander. I think that's for wood, not your feet, but let me know if I'm wrong. I read the comments and this is a proper 80 grit sander. Do I recommend this? No, but this is the difference between a pedicure and a manicure. Okay, we got another toenail and the person here is saying it is the greenies. So basically she's saying it's possibly Pseudomonas because Pseudomonas is sometimes green in color. All right, so she's going in and cleaning up the nail and preparing to cut it back. Like we just talked about, if the nail is not attached to the skin, it actually doesn't need to be there and you can cut it back. This lifting of the nail is called onycholysis. It's when the nail bed separates from the nail plate. Okay, so she's doing a good job cutting it back. And some people in the comments were asking if this is painful. It's likely not. Usually when the nail is not attached to the skin, cutting it back doesn't cause too much pain unless there's an ingrown. Okay. It's already looking way better. And so time will tell how it grows back. It might grow back pretty close to normal. So all you can do is wait and see. Also, she's going in with a burr and sanding it down so it's thinner and more normal. Very good job. Okay, so my first thought here was this looked like a blister that maybe got ruptured, but apparently it's some sort of splinter. I see a little something poking out, but we'll see how big the full thing is. Did you see that? Goodness, that's the second biggest splinter I've ever seen in a foot. If something like this happens to you, make sure to thoroughly wash it with soap and water. Also, consider going to the doctor just to be safe. Sometimes you need antibiotics. And if there's any signs of infection like redness, swelling, drainage, definitely go to the doctor. That's a wrap. Make sure to like, subscribe, and let me know in the comments what videos you want to see next. Bye!